Let it implode all over you. Vote for us. And you know, there are advanced, quote-unquote, government-run healthcare systems in places like Britain. You wonder why our friends, the British, have a problem with teeth? And I don't say this to be offensive or controversial, because they don't have enough dentists. And when the dentists that they do have fill their quotas, they're gone. They go on vacation. It's like the DMV. Would you go to the DMV to get your teeth done? No. And there's story after story in the United Kingdom of one disaster after another. You know how they keep saying in this country, it'll get better and people will like it as time goes on? Well, it's been in place in Britain for over half a century, and it doesn't get better. It gets worse. The Telegraph, thousands of patients, thousands, suffering from cancer and other serious illnesses are being denied the drugs they need from the National Health Service, according to a report. I could give you 100 of these reports. Even though the treatments have been approved by the health service rationing body, see, at least they're honest about what they do. At least 14,000 patients a year are not receiving them. So 14,000 patients a year are not receiving their cancer drugs. As many as 1 in 3 of those suffering from some types of cancer are going without medication that could actually extend their lives, the figures show. You see, big government is not compassionate, ladies and gentlemen. It's the opposite. Experts said the report from the Health and Social Care Information Center, a government agency that provides NHS statistics and analysis of trends in health and social care, exposed, quote, an endemic and disastrous postcode lottery, unquote, of care within the health service. You better get used to this phraseology. Charities said the findings were alarming and meant patients were being condemned to an early death because local NHS bodies were failing to fund drugs even though they'd been proven to work. When the National Institute for Health and Care Excellence, called NICE, this is a joke, NICE, that's the rationing body, was created by the last Labour government, officials promised to end the variation in medical treatment across the country and ensure that if a drug was found to be effective, patients should not have to fight to get it. And yet, ladies and gentlemen, patients in Europe, especially Britain, have to fight for their lives to get treatment, to get procedures, to get surgery, to get prescriptions. They are fighting for their lives. The findings also show that thousands of patients suffering from cancer, motor neuron disease, and an eye condition, which is the most common cause of blindness, are not being given the best medication. So, first of all, you're not getting medication at all in many instances, and if you do, you're not getting the best medication, and I dare say you're not going to get cutting-edge medication. It's rationing. They call it rationing. And even when they approve it, you still don't get it in many cases, thousands of cases. So when you hear people say, look, Obamacare is going to get better, we just need more time, more resources, we need to apply more expertise to this, that is just more lies. They're trying to push their way past the next election and the election after that. This thing, Obamacare, needs to be killed, and it needs to be killed now before it kills many of you. It's that simple. And yes, we're going to keep discussing it, keep exposing it, and keep fighting it. It's much more important than talking about what I did in 7th grade. And I remember what I did in 7th grade.